All right, hello everybody, and welcome to our Caring Campus Network discussion on growing the block for faculty experiences and advice on spreading the Caring Campus spirit. My name is Bala King Rushing. I am Associate Vice President for Caring Campus at IEBC, and thank you all for joining us. Um, we are going to be here for about 90 minutes, and we have a strong panel here of folks who have been through the program or at schools who have been through the program, who will have a lot to say. But then afterwards, we are also going to make sure that you all, as participants, actually get to participate and have a chance to share your questions as well. So this is what today is basically going to look like. As a little bit of background and introduction, um, the Caring Campus Network might be a new logo that you've seen, that you've been seeing, I should say. It's down in the corner of this particular slide. It is one of two major programs that we have started this year as more extensive support for the schools that have become caring campuses. The network in particular is intended to be a way for everybody to be able to communicate with each other, share best practices, help with challenges, that sort of thing. Because now we are in over 130 schools nationwide, and it's become more than we can communicate at any one given time. And we know that there are lots of experiences out there that everybody should be able to learn from, which is one of the reasons we're having this particular discussion. The network is a membership program, and this year, everybody, all these member schools will have their memberships or have had their memberships paid for by the ECMC Foundation, to whom we want to give a lot of thanks for that. And the ability to attend these discussions without an enrollment fee is one of the benefits that members get. Membership is an annual renewal, and next year, or not next year, next month is May, right? I believe you'll be hearing a lot more about the evolution of the network as we move forward. So, time for introductions. We have 5 speakers from 4 different schools. I'm going to ask each one to spend a minute introducing themselves, and then we can get started. Brian, why don't you go first?
Yeah, thank you. My name's Brian Benson, and I'm an associate professor of English at Tulsa Community College. And we're a college that's spread out throughout the community. So we have 4 satellite locations, and I'm on the Metro campus right in the middle of downtown. And I was fortunate enough to be a faculty development fellow when this initiative was brought forth to our institution and was invited to kind of partake in some of the early foundational steps. And it's been a real pleasure to see how it's grown since then. So thank you for having me.
Absolutely. Thank you and welcome. Mara?
Hi, everyone. My name is Maura Kavanaugh Dick. I'm the Associate Dean of Academic Affairs here at Salem Community College. We're the smallest community college in the state of New Jersey. And just fun fact, I guess fun, we had a 4.8 on the Richter scale earthquake this morning. So it's the afternoon here in New Jersey, and we're all safe and sound. But if I'm a little shaken, it was a little different for us. But a little bit about myself. I've been here at the college for almost 19 years now. 13 years of that was as associate professor of biology. And I've been serving as associate dean for 6 years. I also still teach classes, so I am an active faculty member as well. And just a little bit about our college. We're very small. We only have about 1,100 students. So great to be here with you all.
Excellent. Thank you and welcome. Sarah? You're muted, Sarah. There you go.
I'm muted now. Can you
Yes.
hear me? Okay. I'm Sarah Johnson. I serve as an English instructor at Lawson State Community College. We have 2 campuses. I've worked at Lawson since 2017, and I also serve as the faculty coordinator for Caring Campus.
Thank you so much, and welcome. And we have two from Oakton College. Shannon, why don't you go first?
Hi, everyone. My name is Shannon Sloan Spice. I'm a lecturer in the Humanities and Philosophy Department at Oakton. I've been there since 2015. And in my very first semester, we had a pilot program for the Persistence Project that I participated in. And I have been chair now of the Persistence Project since 2020. So co-chair. Yeah, so glad to be here. Thank you so much.
And last but not least, welcome, Shannon. And last but not least, Nicole.
Hi, welcome to this panel. My name is Nicole Perry. I am co-chair of biology. I teach anatomy and physiology classes when I'm in the classroom, but then I'm also department chair of biology and co-chair of the Persistence Project at Oakton with Shannon. I am a full-time faculty member. Shannon is a part-time faculty member. So we do value and use part-timers as a part of our leadership at Oakton for this project. Oakton, just to give a little bit of overview, we serve about, I think we're now about 7,500, 8,000 students, 2 different campuses, serving the north suburbs of Chicago.
Excellent and welcome. Thank you. And while we're talking, or you've mentioned a little bit the Persistence Project, I think that'll help us get started. Because my first question that I'm going to ask a couple of you is, what are some of the highlights of your Caring Campus program, and what are you looking forward to achieving in the near future or have recently completed? So Nicole and Shannon, would you tell us a little bit about the Persistence Project and how that's related to Caring Campus?
Sure. Well, we had Brad come and mentor our college in 2015. It might have been in the spring of 2015, and that gave birth to a pilot project that the Humanities and Philosophy Department did in fall of 2015. And basically, we came up with, the agreements that we settled on were meeting with the students for 10 to 15-minute interviews, learning all the students' names in the first 3 weeks, giving a sense of rigor, but also academic grace where necessarily. So no policies that would infringe too much on student success. And then what's the other one I'm missing, Nicole? That was 3. The early assessment feedback.
Early assessment, you didn't say.
Yes, early assessment. So we used to have pre-pandemic, we would even include going to a school event with students, but that kind of went away with the pandemic. So we've been doing this work for almost 9 years. We have a lot of data right now, just showing how much the relationship-rich education makes a difference in student persistence. Nicole, did you want to add anything?
I would add too that we started this project before we went through the Caring Campus, and then as a part of the Caring Campus training, we refined the project. So it really used the Caring Campus model and discussions to really look at how we were marketing the project, what we could do to recruit more faculty in the project, and refining our behavior commitment. So it was more of a refining of the project as we went through Caring Campus than it was creating the project.
There you go. And as I understand it, the Persistence Project is becoming permanently institutionalized at Oakton?
We are permanently institutionalizing the project as of fall 24. So it's been a little bit of a rocky year, trying to figure out how that was going to work. But as of spring 23, there was a decision that was made that Persistence Project no longer needed to be under the umbrella of the Student Success Team at Oakton, and that the Student Success Team would take a different initiative. And so there were Persistence Project is now going to become a special academic program, which then means that the release time for the chairs is negotiated a little differently, and how it's integrated into Oakton culture is a little bit different. It's no longer under that student success team umbrella. It actually has its own heading. It will have its own web page. It will have a lot more institutionalized support. We have a lot of support now, but we'll have even more as we move forward.
Excellent. Thank you. Congratulations. That's really exciting. We always love it when the Caring Campus and its associated programs get to be recognized as their own powerful units on a campus. Excuse me. So on a different campus, let's ask Brian the same question. What are some highlights of your Caring Campus program, and what have you all recently completed at Tulsa or looking forward to in the near future?
Well, in terms of highlights, we kind of started this project right at the height of the pandemic, and I was invited into the group in January of 2021. So we were really at that point in the preliminary design phases where our kind of prestigious faculty that were noted for higher persistence in their students and kind of better reaching of the outcomes in their courses got together and developed some criteria or some components that we promoted campus wide. And that was kind of the initial effort, was to advertise and share those what we called pillars of the Caring Campus initiative with the rest of the campus. We started with faculty, kind of a smaller group, and offered some, at that point, hybrid sessions through Zoom. Some people were on campus, but it was still, again, during the pandemic. So we kind of had a little bit of a rocky start figuring out how to get more people involved. Once COVID kind of went away, if I can use that phrase, if it's even accurate, we were able to then get back together on campus and got a little bit more traction at that point by offering more cohesive sessions on each one of our satellite campuses. We offered 2 in the fall of 2023, that would be last fall, and 2 this spring as well. So those really opened up the door, not just to faculty, but we started getting some student-facing staff from like our support services, writing centers, even some of our math centers, math labs were showing up and kind of figuring out how they could incorporate the components that we were promoting. Then it got kind of exciting because this spring we were able to connect this Caring Campus initiative to a TCC Engaged, which is our website that's connected through GivePulse. This is a place where students can go and sign up for student service hours, which is closely connected to a scholarship that we run called Tulsa Achieves. And in that program, our students are required to do a certain amount of service. And it was really exciting to see, and that was probably the biggest highlight this spring, to have students show up and share their insights on how some of these initiatives that we've been promoting have worked for them and the things that they've benefited from that. So that was probably the most exciting thing we've had. But outside of that, we've also have been trying to work with individual support labs, going to what we have is called an Academy of Teaching Excellence for our newly hired faculty and staff, where we kind of interact with them. We also have a very exciting design institute that I believe we're kind of replanning right now, and a lot of our Caring Campus features were offered through that, and that was kind of a nice cohesive group of 25 faculty, kind of professional development at the end of the semester. So at this point, we're going to assess how this academic year has gone, and then kind of plan to regroup, update some of our videos, and rethink some new activities for this coming fall.
Excellent. Thank you. That's an awful lot going on. Exciting.
We're trying to catch as many nets as we can, because we're going to need to get that institutional support, and we're starting to gain that by our wide nets. So. Sure.
Fantastic. That's a great strategy. For those who may not be entirely familiar with the process, when a college or university engages with IABC to introduce Caring Campus at their school, we send a coach, and the program is either tailored for the faculty or for the staff. There are two different versions, well, three different versions, because there's one for administration as well. And we start with a core group of faculty who receive the coaching about the principles and sort of build the skeleton of the program for their college. And then it grows from there. We provide support, but really we give ownership to that faculty group, because every campus has its own personality and has to sort of do these things differently. So with that in mind, Brian, let me stick with you. Stepping back, what did your core original Caring Campus group do to spread the word about Caring Campus amongst your faculty colleagues after the coaching?
That's a great question, because at a community college, we're so focused on not siloing, or not kind of like siloing out and doing our own things at our respective campuses. So our big initiative has been to combine all the campuses to make it a campus-wide initiative, even though we're in different parts of our Tulsa community. And so the way we have to do things is think, well, when is everyone going to be in the same place at the same time to get this initiative going? And of course, we have our opening fall convocation to where everyone attends, and we usually have a keynote speaker, and shortly after that, respective presentations from around the campus community. One of those was our Caring Campus presentation. And the summer before that, that would be like the summer of, I think, 2022, we got together and put together this nice video of about 5 or 6 minutes where everyone that was involved in that core group kind of shared their thoughts and approaches and feelings about the work we're doing behind this. And then because we're all together in that convocation setting, we could just air the video and then kind of do a short Q&A as needed. So that really was a first initiative to get the word out. And then we kind of had to figure out what groups of faculty, staff, students, how we wanted to approach those smaller sets of our community. That kind of evolved into something that we were calling TCC Today, which is kind of put together by Engaged Learning and Student Support Services. And it's a campus-wide email that goes out to faculty, staff, and students sharing kind of what's going on around our Tulsa Community College campuses. That helped get some more traction, get some word out. And then we were able again to broaden out and start doing individual presentations on our respective campuses to where we needed to go. If it was labs, support services, staff that were requiring a kind of a presentation. But that was really a lot of the groundwork that we needed before we can start specializing in the presentations we do.
Okay. Thank you. And to be clear, TCC Today, is that a regular newsletter, or was that a one-time email?
This is now a regular email that goes out. You know, we've heard kind of, well, it goes out too often, doesn't go out enough. So we're trying to capture that fine balance there, the Goldilocks situation. But it is a systematic, kind of consistent email of at least daily almost, if not weekly. So,
okay. Thanks.
And I will add one last thing. I apologize.
Sure.
We also have a LibGuide designed by our great librarians that pulls together a lot of the handouts, planning, organizations, events that we're a part of, and that's accessible to all TCC community.
Excellent. Yeah, the library is a great central resource. I believe that. And let's move on to Lawson State. Same question. What did your core Caring Campus group do to spread the word amongst the faculty after coaching had been completed?
Okay, we were fortunate to unite with the staff group of Caring Campus at Lawson and work as a united front in getting the word out. So we were not alone. We had help from staff as well as faculty. We established focus groups. We worked during the summer last year to get the word out via these focus groups for faculty, staff, and students. We also have a Caring Campus cross-departmental awareness lunch and learn session that's conducted 2 times per term. These sessions are designed to assist everyone, faculty as well as staff, in understanding what the various resource departments are across campus so that we'll know how to send students and where to send students if they need help. Financial aid, I think student services, the Success Center and others participate. These are virtual, and these seem to have worked really well for us. We've instituted the use of Caring Campus name tags so that we'll kind of know each other. And we caught people in the act of caring, giving them small gifts of candy bags if we found them wearing their tags. And this has worked well to get the word out. Also, there's Welcome Week for the students, where students can meet faculty and new faculty can meet old faculty and that sort of thing. So all of these efforts have worked well. In addition, we, like Brian mentioned, bring Caring Campus to the front at every professional development meeting. We give a report to the faculty at large, as well as the staff. We also did something I think kind of unique in forming a steering committee of staff representatives as well as faculty. And we presented what we were doing to the deans of the college so that they would know what we were doing, and we would form more of a united front in getting our word out.
Wow, that's sorry.
Hey, Sarah, it's
Yes.
Cherie. Can you mention, I just want to brag on us a little bit. Can you mention the awards?
Oh, yes. We decided to do a Caring Campus Awards ceremony where we would award those persons who were noted or voted upon for being Caring Campus people, Caring Campus faculty members, and students as well as staff and faculty would be able to participate in this activity. Thank you, Dr. Davis.
Yeah, that's excellent. We already have a great list of different ways that the word can be spread, from convocation and focus groups to newsletters. And I love the lunch and learn idea, as well as reporting out at meetings. But awards, celebrating the work is something that we always like to foster and encourage. Sarah, let me ask you also, what kinds of challenges or resistance or objections did you encounter as you were trying to spread Caring Campus, and how did you and the college deal with that?
Well, I think the only kind of resistance that you'll get would be people who are rather suspicious, a little nervous about joining another committee, another responsibility. I think that's something that would happen at most campuses. But one of the things that's helped me most has been the support of our administrators, such as Dr. Davis and Dr. Crawford and our president, and really putting it forth that this is something that's great, something that we need, something that's going to help us as an institution. I think that kind of enthusiastic support has been great. For example, I was given help as a beginner with this project. I was assigned I had a volunteer from the faculty, a veteran volunteer, Mr. Rand Armbruster, who had been around for over 20 years to help me meet new people and people that I didn't know, because I'm actually an adjunct. I think that kind of support has really helped. And as we met faculty and kind of got everything going with a lot of enthusiasm and motivation on our part, I think it caught fire and others wanted to join.
Excellent. Excellent. Thank you. And Maura, what about at Salem? Did you all face challenges? What kinds of objections did you have to overcome in the spreading of Caring Campus across your college?
Yeah, and just real quickly, we did follow a little bit of a different model than the traditional Caring Campus model. So we actually had a 4-day session with Dr. Brad Phillips came in August of 2023. So we're new to the Caring Campus Network, and so very excited to be part of the group. But we actually trained our entire staff, faculty, and administration all in 4 days. And so Dr. Phillips stayed 4 days with us. And it really created a sense of kind of kickoff for our semester. And so in terms of challenges, you know, we started welcome tables. We got name tags for everybody right off the bat. We got T-shirts for everybody with our Caring Campus logo. You probably can't see that. And so we tried to, like Sarah said, build as much excitement around it as possible and talk about it at every meeting. The Caring Campus was reported out even at our college coordinating committee and in our campus chronicles every 2 weeks. So we've tried this year to really make it part of our messaging. Even the executive staff has it on our agenda every meeting. So I would say the only pushback we've gotten is that we're already a very small family-oriented campus. And so some people said, wait a minute, we're already caring. And we said, we know you are. So what we want to do is lean into that strength a little bit more. We actually have the highest graduation rate in New Jersey already. We had already been working on retention activities with early assessments and syllabi. So what we wanted to do is really lean in and make these the commitments more intentional. And so we really tried to listen to faculty when they said, hey, you know, this is another thing for me to do, or other things, and really listen to them and say, hey, we're already doing these things. We just want to try to make them more consistent and really help the adjunct faculty, the part-time faculty, feel part of it as well. We have about 20 full-time faculty and 100 adjunct faculty, so we're small, but we're mighty. And we really have embraced it. So we're excited to, you know, continue. I'd say the other thing, we just had a meeting yesterday, and the other challenge that has come up is a little bit of the situational fairness. You know, in terms of some of the faculty trying to balance the caring with the holding students accountable. And so we're really, I love Sarah's idea about having the lunch and learns because I mentioned to them, hey, maybe, you know, I'm a faculty member and an administrator. So I said, maybe we should have some meetings to discuss this. How can we kind of work through some best practices? So I think those are the two resistance challenges that we've had a little bit with faculty. But staff have been great because they're also in on it too. So, you know, we've really had a lot of collaboration with staff as well.
Yeah, that's actually worth mentioning in a little bit greater detail is when we work with the very small schools like Salem, we do have this intensive training that tries to incorporate or tries to bring in everybody, because you can get everybody into a single room or a couple of rooms at the same time. And it is intense though, 4 days. But it is another approach to bringing Caring Campus to a college that is particularly small. Thank you. That's pretty exciting, thinking about how things can be shared both within and across the employee groups in particular. That's wonderful. On that note, let me ask you, at Salem, let's start with that, because it was so small and because you are, you or your folks at least thought that you started with a caring culture already, right? So with that in place, how do you think, or how would you say Caring Campus has affected the culture in the short time that you've had it?
Yes, as you just reiterated, we already were a very caring place. And so I felt, everyone felt like we were leaning into our strengths. It's really become part of our everyday language. It's really at every meeting, we're talking about Caring Campus. At every event or decision-making point at this point, whether it's faculty deciding on a new faculty member to hire, or working with a student. Someone may say, oh yeah, the Caring Campus way of doing this to work with the student would be to, think about situational fairness or other things. So it's really becoming part of the everyday conversation to talk about that. Even in event planning, we're having an Eclipse event on Monday, and we'll have a Caring Campus table there with some giveaways and swag so that the students feel part of it. We have a couple other grants for mental health and for hunger-free campus. And Caring Campus has become a part of that, to the point that even students are now, hey, how can I help be caring to other students? And so they're putting together, little snack bags that students can pick up if they need to. So that's been really great. And I'd say the other thing, as an administrator, we just got all the nominations for awards. And it was great to see so many people celebrating other staff members and faculty members on campus and mentioning all the caring behaviors and attitudes in their nominations. It was really hard to choose our award winners this year because we got more nominations than we've ever gotten before. And as I said, we just started this in the fall. So I really think that's something. And then just the other day, I was in a classroom with some students, and so is my vice president. And we heard students say they really feel seen at SCC. And I think that was going on before, but I think our intentional behaviors, wearing our t-shirts on campus, wearing our name tags, being accessible, being fair, and those types of things, and learning their names and their stories has really resonated with them.
Wow, that's excellent. I'm glad to hear it's spread beyond the employee groups and to the students as well. That's a pretty exciting evolution, and definitely shows how when we talk about culture change, even if the culture is already in that direction, which most of our campuses already have. We don't generally try to engage with a school that isn't already ready to, as you say, lean in to the Caring Campus principles. So that's fantastic. And at a larger school, on your path to institutionalization, Shannon and Nicole, how would you say that Caring Campus has affected the culture at Oakton?
There's been so many changes, with the pandemic that, really illustrated so perfectly why Caring Campus initiatives matter, because we had so many students in crisis during that time. And I think that we did a very good job of trying to meet that need and be supportive to our students. I think one of the interesting things about Caring Campus, and I know that there's a lot of adjuncts on this panel, but one of the challenges is the fact that adjuncting labor is kind of exploited labor, and people want to be paid for the work that they do. And we have plenty of adjuncts who do the work and refuse the payment because they're at their LHEs. And so, we have people that are very invested philosophically. But what I will say is that I have seen a change in our administration around how we treat our adjunct teaching body. That is to say, I'm seeing more adjuncts being hired for full-time positions from our own pool, whereas we used to have kind of this way of always wanting to import talent, but never really looking at the talent that was already there doing the work. And that has been so rewarding to see really good people, knowing that Caring Campus doesn't just include our students, but if we're not taking care of our teachers as well, that's the foundation of our classroom. And so it's been really beautiful to see this sort of intermingling of our commitment to equity actually come into what we're doing as teachers. So that's been really great.
That's awesome. That is a something that comes up sometimes, at least in my experience with coaching. Employee groups, whether it's staff or faculty, will sometimes ask, "How are we supposed to care for the students if we don't feel like we're being cared for by our institution?" So it's really heartwarming to hear that has been a major change at Oakton, and talent close to home is really important too. So that's really exciting. Nicole, do you have anything to share on that? Oh, I'm sorry. There we go. Nicole, do you have anything to add on that, on culture change?
Okay. I would also add that we've gotten national recognition for this project, and that has changed, as Shannon said, has changed how the administration views the project. And I think is also starting to change how faculty view the project. So it's really been nice to see that culture change. And all incoming traditional age students have to do an orientation session, an in-person orientation session now. And that as a part of that session, there's been parents of traditional age students that have asked, how do I get my student in one of these classes that is Persistence Project supported? Because unfortunately, not all classes at Oakton are Persistence Project supported, just because it is a significant time commitment. And so it's very interesting to see it even bleeding out into parents of students who want to have their students have that experience, and students want to have that experience. So part of it that we're working on now is, how do we get the word out to students in a way that is effective and consistent with the resources that we have available to do such a thing at Oakton.
Interesting. That's that shows the size of the entire, or not the size, the extent of the entire community and how it can be affected by these kinds of things. Nicole, let me ask you, you have ways to keep the students informed about the Persistence Project, but stepping back to sort of Caring Campus more widely, since that is a more widespread program than Persistence, how do you keep faculty informed about progress and activities of what's going on with Caring Campus?
I would say we are constantly working with the deans of each of our major divisions and communicating with them as a part of us becoming institutionalized. We are actually the co-chairs of the Persistence Project are meeting with the deans on a regular basis. So all the academic deans. We have the staff at Oakton also went through Caring Campus training. We've been trying as Persistence Project co-chairs to connect up with that side of the house to make sure that we can connect that way. However, there's been a bunch of turnover in staffing that has not led to that connection working as well as it could. And see where else. Oh, and then in terms of, we do a lot of emailing to faculty. We do communication in a weekly newsletter at times. We do presentations at our Welcome Week, our Orientation Week in service for faculty and staff. We're constantly sharing data in different means, whether that's a seminar during the course of this Equity Summit during the course of the year, or it's at a department meeting. So we invited in a speaker or the author of Relationship Rich Education, which ties into some of the ideas of Caring Campus, to a faculty retreat. So we've really tried to integrate the Persistence Project in a variety of different ways into what we do at Oakton and to help get the word out. It still doesn't mean that we have 100% support or 100% participation. We're probably right around 25 to 30% of the faculty actually agree to do the commitments every semester. So we're not at 100%, and I don't think we'll ever require every faculty to do it. Well, it will probably always be a self-selecting population at Oakton.
And that makes sense. We are not about trying to force people to make change. That would be kind of, you know, disingenuous and counter to the caring attitudes that we're trying to promote. Let me ask it, Lawson State, Sarah, you mentioned a lot of different ways that you have communication with faculty, but between since you had both faculty and staff go through the program at Lawson, what kinds of things keep Caring Campus at the front of everybody's mind, or at the forefront of the actions and events that are going on there?
I think the main thing that keeps it at the forefront or at the top of the list in terms of activities would be the introduction of it at the professional developmental meetings, department meetings, putting it out there so people know that this is important. This is not just another activity that will go away, that Caring Campus is really here to stay. So I think the sharing of these of Caring Campus, defining what it is, what we're trying to do, how important it is for retention of students. I think that that's helping us to keep it at the top of everybody's mind as far as how important it is for the survival of the institution and how important it is to the retention of our student body. We also, I think I may have mentioned the faculty focus groups. We are really pushing that and having meetings, at least maybe 2 per term, where we invite faculty to talk about issues of importance. Sometimes you can feel, particularly as an adjunct, you could feel that you're in a silo. You're all by yourself. You're the Lone Ranger out there. You teach your class, you go home. But when you have an opportunity to talk to other faculty members, you find out some of the issues that you're facing, other faculty members are facing those same issues, and find ways that Caring Campus, the whole initiative, can help all of us to retain our students and move forward as an institution. I think all of those things help us tremendously.
Excellent. Yeah, I didn't realize the focus groups were an ongoing activity, which is really cool. And so I guess that then takes us into the question about feedback. You use the focus groups to get feedback from the faculty and staff about how Caring Campus is affecting them and what they need to do about it.
Absolutely, absolutely. The staff group, I think they may have about 10 representatives over there. We've got about 8 or 10 ongoing faculty members who are participating in these focus groups, and we're kind of going with each one, teach one philosophy, trying to get everybody to go out and bring other people in who want to be a part of our focus groups.
Excellent. So kind of like a mentoring model. Yes. I love that. Brian, at Tulsa, is there any kind of formal feedback mechanism like that?
We attach when we do our sessions either through Zoom or face to face, and we're even considering maybe hybrid in the future. We still got to get together to decide that. We do provide after that a feedback form to kind of create that loop for us, and then we kind of assess and change as needed. And that'll be something that's going to be kind of the forefront of our minds at the end of this semester to incorporate all of that. But at this point, that's about as far as I believe we've made that.
Who is it who oversees or receives the info from the surveys?
That would be Cindy Shanks, our Dean of Engaged Learning, as well as myself when they actually email me, because I am kind of the point of contact for that. But yeah, that pretty much is funneled through just a very small group of people.
Okay. Well, surveys are definitely an effective way to gather that kind of feedback. I know a lot of caring campuses use surveys to get feedback from their students about how the program is affecting student performance, success, general culture. So it's absolutely appropriate to use within the employee groups as well. I can definitely appreciate that. And Salem, as a new, Maura, as a new implementer of Caring Campus at Salem, have you all planned for feedback? Do you have plans for feedback from faculty and staff about how things are going? How's that going over there?
We do. As you said, a lot of schools are focusing on getting some feedback from students. So we have some surveys getting ready to go out to students. And we didn't want to over survey our staff too much. We're also part of something Great Colleges to Work For. And so that had a whole survey, which I think we can glean some from that with some of the behaviors, since we did that survey during this time frame that had already been planned. But we have some smaller, like Sarah, our model is a little bit different. We have a steering committee that's heading up this, which is kind of our focus group as well. So we get kind of feedback from our steering committee at the faculty level. How are things going? I just met with my department yesterday, and we did Caring Campus Moments, but I also asked for Caring Campus Reflections about how things were going. And that's where the item came up about situational fairness, because we have 4 weeks left in the semester. So faculty were feeling that. So I wanted to hear a little bit of their feedback. As a fellow teacher who's also teaching anatomy and physiology, hello, Nicole. But then also, as their administrator from that as well. So, I love surveys, and I love, the feedback we get from that, but I get a lot of information from my one-on-one conversations with my faculty. And we're small enough, I should say, to be able to get some of that feedback one-on-one. And so that's been really, really helpful. But our IRP department is working on some more official survey items that then we'll hopefully get some feedback from the staff. And then we're also collecting data on our student results, obviously, in terms of success and retention, that hopefully we can share with faculty going forward.
Excellent. Speaking of data, let me ask Shannon and Nicole, I believe Oakton's been pretty rigorous about collecting data on the performance of Caring Campus and the Persistence Project. What can you tell us about that?
So I'll take this one, since my subcommittee on our persistence leadership team is the data team. So we have routinely collected data that compares the overall persistence rate at Oakton, so fall to spring persistence, and then fall to fall persistence, and then taken that data and then compared that data to students that are in at least one persistence project supported class. And when we overall, and when we desegregate by race and ethnicity, age, and gender, we do see about anywhere from a 7 to 15% difference in the positive of students who are in persistence project supported sections compared to overall. I mentioned in the chat that Oakton is doing the CESI survey this spring. And so one of the things we're doing with the CESI survey is we're actually going to look at if there is any difference in those results in persistence supported sections versus non-persistent supported sections. We do also routinely collect what percentage in each division, how many faculty are participating in the project every year. And then we have a member of the Office of Research and Planning on our leadership team And her and I, along with one or two other members from the team, develop a data plan. And so the data plan routinely includes the persistence numbers, but then also may look at other different questions that Oakton is focusing on for that year. So for the example, this year we're looking at Gateway English and Math classes. And so one of the ideas is to look at, is there any difference between persistence project supported classes in Gateway and English and Math, or are students who are persistence project supported doing their math and English earlier? So we'll be looking at questions like that. But every year it changes a little bit with some of the consistent numbers, or some of the some unique questions, but then some questions that we've been looking at for the past consistently for the past 5 years. Our data collection in the beginning was a little wonky.
Sure. It takes time to develop those things. But that's a lot of promising information. And we have seen at IEBC a lot of the positive data that comes out of Oakton. I'm wondering at Oakton, with that positive, the positive results on student success and persistence that you have seen sort of more quantitatively, or at least concretely, has that had any effect on the adoption rate among faculty? How much do they see it? How much do they believe it? And what does that do to faculty and their relationship with Caring Campus?
I think we have seen, certainly with Leo Lambert coming in and giving his talk at the beginning of the semester for our faculty retreat, the honorable mentions in his book about the work that we do really invigorated our community. Like everything else, it's important to know that not every professor can do. I like to do the persistence project in my classes at Oakton when I teach at Northern Vermont University. I mean, I do it in places where there is no Caring Campus yet. It's just a part of my pedagogy. I would never do it in any other way. However, there's burnout to this work as well. And that is something that we have to allow faculty to really be able to step back when they need to. And sometimes those breaks, have been for a year. And, we saw some people invigorated coming back for the first time in a little bit since the pandemic. So there's an ebb and flow to it. I would also say we have like a staunch group of people who will never do the persistence project because they're already doing relationship rich education, and why stand and be counted? So there's always going to be various different reasons why people will be resistant to it. But certainly this year, being able to compare our persistence project numbers to non-persistence project classes has been a really significant uptick in our data presentation. And the proof is in the pudding.
Absolutely. I couldn't agree more. And I love your mention of the resistors, because we at IEBC are very cognizant that whenever Caring Campus comes to a new place, there are always people who resist for any of a number of reasons. And it could be because they feel that they're already doing that kind of thing, or, they might not be interested and think it's one of those, sort of fly by night initiatives that comes by, even though we try to reinforce that this is programmatic. This is something that we want to be institutionalized. But in any case, it's good to hear that there is that kind of effect. And ultimately, there's no need to fight the resistors, right? As adoption amongst those who are positive about it increases, as you say, the proof is in the pudding. It will show its own levels of success. Excuse me. Okay, so those are my major questions. I'm going to have one last one, and I'd like to ask each of you. I know you have different levels of what you might want to say about this, but just generally, what advice might you give to a college that is just getting started with Caring Campus for faculty, to whom it's kind of new? And Maura, because Salem is new, I'm going to start with you. And again, I'm going to note that because you're a very small college, you went through it a little bit differently. But in the end, the institutionalization, I think, is going to be have parallels with others.
Yeah, I would say, I mean, if you're either thinking about starting or starting, do it, because I think it's a wonderful, right? It's not an initiative or a program. It's a culture shift. It's a philosophy on campus. So definitely do it. And then I guess two other things: find champions within administration who will provide support to the faculty. I think as a fellow faculty member, I always valued when the administration saw me and saw my work, and if I wasn't as natural as Shannon was just talking about at some of these pedagogical skills to help those faculty learn and have opportunities for learning. And then finally, tell the stories of students. Whenever I've felt a little resistance or things might be pausing for a second, we take a moment to just say, and I think Brad did this in our training. He asked us, tell a time when you felt like someone cared about you. And I asked faculty, tell me some time where you felt like someone cared about you or you saw a student being cared about this week. And once they start talking, you start to feel the sense of the culture shift within the room. And then the conversations can move to good teaching, excellence, your retention, and all those supportive behaviors. But it comes down to the stories of the students and changing lives for all of them. I think Brad put something in the chat about equity. There's a lot of students who don't feel seen. And so letting them feel seen, letting their stories feel heard, and their journeys valued, that's really what this is all about. And so embrace it, because I think it's a wonderful program.
Embrace it. I love that. Thank you. Brian, what about from the experience at Tulsa, which is again a shorter term, you all a little bit more on the early side of the spectrum?
Yeah, I would say to start simple and then become more complex, because I'm afraid that if you try to do too many things at once, you're going to kind of fizzle out a little bit. And that's why we had to think about what was the best approach for our respective institutional culture and how we're made up and composed. But I kind of want to echo what Maura said, that at the front of this work is the student experience, and keeping that at the front of your mind as you're trying to make this more of an institutional culture or even embedded a little bit more, I think was really kind of a saving grace for me, because sometimes, we mentioned a little earlier, the idea of burnout and a little bit of getting kind of tired of this. But every time you think about everything that we do related to Caring Campus will make the students' experience of their education even stronger, which is a lifelong change for them. And that to me is all the motivation I needed. So keeping that at the front and then figuring out how to crawl before you walk.
Mm-hmm. Absolutely. And that highlights, again, every campus is different, has its own personality. And so you do kind of have to do this in your own way as you're evolving how Caring Campus becomes a part of your culture. And speaking of that, Lawson State has been a Caring Campus, excuse me, a lot longer. And I know that for our coaches, in many cases, some of the things that have happened over there have become models for what we show as part of the coaching in new colleges and universities that are part of the program. So Sarah, what advice might you give to colleges that are just finishing up, just going through Caring Campus and trying to see how they can spread the word among their faculty and make the program stronger?
I really think the selection and the continuous selection and tapping of highly energetic people on campus via the faculty and staff, people who are very enthusiastic and positive about the Caring Campus effort and about wanting to really give back to the institution. I think that those persons, if you are a Caring Campus faculty coordinator, or if you're a staff coordinator, whatever your job is, getting others, recruiting other people who have enthusiasm for what you're trying to do and who really want to make a contribution beyond that of just teaching your classes or doing your job, but you really want to give back to the institution and to students. I think that's greatly something very important. Another important thing I think should be infused into whatever is going on with Caring Campus is that of getting human resources involved and others with the onboarding of new faculty, adjunct and full, about Caring Campus, orientating your new people to what your expectations are with Caring Campus. We think those are very important things that should go on. And finally, um, starting out as a duo, because fortunately for me, as I stated, I'm an adjunct. So, but I was had the assistance of a veteran teacher at Lawson, someone who had been there for many, many years and knew a lot of the faculty members. This was really a great plus to me and continues to be a great plus to me as we try to get the word out. And I would think that this is something great that could be that any college could do. Getting again people who are really enthusiastic, people who really want to go beyond just the everyday work, beyond just teaching and serving on committees, but really want to give back to the institution.
So a lot of that is just as we're trying to bring the human touch or the personal touch to interactions with students. That seems to be a great way to spread the spirit amongst the employees, is to have that personal touch from, as you say, from veterans to new people. That sounds like a really fantastic organic way to make that, to keep it going, to keep it sustained. I will also mention, because you mentioned onboarding and HR, that is actually something that we at IABC are really supportive of. If you want to see strong institutionalization of Caring Campus, we definitely advise getting your HR involved, including it in onboarding. There are schools where it has been included in job descriptions when possible. I know that's not possible in every jurisdiction. You know, different places deal with that in different ways. But that's definitely quite effective. Also in the hiring process as part of interviews or part of job postings, to sort of ensure that everyone you bring on board is going to join the bandwagon anyway. You know, that's a really strong way to help keep things going and make sure that your effectiveness is as strong as it can be. And on that note, as part of our support from IABC to the colleges and universities we've been working with, we have just started offering what we call the Caring Campus Academy, which if you haven't heard about it yet, and hopefully at least the administrators at your colleges have, is an onboarding opportunity. If you don't have that sort of capacity built into to the way things work on your campus, you can send your new folks through our academy. It is a 5-week series of sessions that explains all of the principles and gets them discussing, but also dealing in practical ways with absorbing the behaviors so that they can get up to speed as quickly as possible and dive into the Caring Campus culture that you have established feet first, if you will. Okay, so thank you all very much. This has been fantastic, actually, and I'm really looking forward to hearing what our participants have to say, as well, what our audience has to say. I'd like to take the opportunity to break us into some groups, smaller groups that can discuss these questions. What's the biggest idea, sort of like a takeaway that you might take back to your college or university from this discussion? Also, what else might you like to know? Are there any, further questions or clarifications that you might like to hear about from any of our panelists? And then finally, what else might you add to the collection of ideas? Again, we've been coming up with a lot of specific strategies, using convocation, using newsletters, etc., to spread the word. If you have other ideas that we might not have heard about, we'd love to hear about those as well. So with that in mind, let's see. I think about 3 groups of 6 or 5 would probably be a good way to go. Let's see, I don't have that. Oops, sorry. Natalie, would you be able to help me out with that? Oh, you know what? It looks like our group has shrunk a little bit. Maybe we can just do this as a group.
Okay.
Yeah, I'll leave the questions up and do this as a single group. So let's have some thoughts from the rest of the participants. What's the biggest takeaway you've got that you might be able to take back to your college? Feel free to just unmute. I can't see the raised hands if anybody is doing that.
Sorry, I was on mute. I was talking, but I was on mute the entire time. This is Cherie Davis. I love the academy idea. That's fantastic. Can you hear
Excellent.
me?
Yeah, yes, we can hear you.
Okay.
We're very excited about it.
Can that be used for not just new faculty, but for all faculty?
Yes,
Or is it just
actually,
specific for new?
it is designed to help get the new folks up to speed, but also, as the program goes on over the years, we feel it's absolutely appropriate for anyone who might want a refresher or see how things have evolved as we are constantly updating the program, can stay on top of that as well.
Yeah, I may have missed this, and Ken, forgive me if Ken's probably told me about this and I may have forgotten. But some of these wonderful, I loved all the presentations today, but I was thinking, wow, I wish I could get my hands on that, or I wish I could get my hands on that. Is there a place where we share resources that we can, instead of us reinventing the wheel here, right? So are there places where best practices, or maybe there's handouts that people are using and sharing at their schools? Is there a place that we can get that information or share it amongst ourselves?
I am so glad you asked that question. Actually, so I mentioned the Caring Campus Network, and all of your colleges are already members thanks to the ECMC grant that we have been working with. But part of the network benefits will be access to an online searchable database for all kinds of items related to the commitments and the implementation of Caring Campus, examples of sort of, swag, t-shirts, coffee mugs, things like that.
Okay.
So that's coming. But in the meantime, if there's something specific that you're looking for, you can absolutely contact us directly, and we can reach out to 1 or 2 schools we know have done the kind of thing that you're looking for and get you in touch with them directly at this point.
Okay, thanks.
What else as far as major takeaways?
Well, I just wanted to also mention the database. Can you talk a little bit about that? That's coming online, the ability to share artifacts?
Yeah, so we're going to have a member portal for the Caring Campus colleges and universities. And it will be, it's a relatively straightforward interface, but items will be tagged, whether they can be all kinds of things like training videos, documentation, examples of newsletters. One thing that hasn't been mentioned in our discussion here is getting boards, trustees involved, or at least notified about Caring Campus and how it's going at individual schools. But there are examples of board documentation or incorporating Caring Campus into strategic documents, vision and mission statements, president statements, and all of that will be associated with, there will be keywords, they'll be searchable by commitment, if you're interested in specific commitment related items, if you're looking for specific types of media, or if you are looking for items from a particular college, that'll be searchable by college as well. And we'll have the contact information there directly once this is up and running in June. I believe it'll be June, so that you can get more information directly. As we say, we're trying to build a community because it is getting to be larger than we can hold in our own hands here at IABC. And so we want everybody to be able to help each other. And as you say, not have to reinvent the wheel. By the way, you heard Maura mention a couple of times, Brad, if you don't know, Brad Phillips is our CEO. Thank you for being here and being a part of this. Did you have anything you wanted to say about it? About about spreading the word with Caring Campus faculty? No, okay, good so far. Thank you. So were there any further questions, anything that anyone thought should be or might use some further clarification from what you heard? We had a lot of information to absorb during this last little more than an hour. And it's fantastic. And we will be making this recording available to everybody so that you don't have to necessarily remember it all yourself or scrambling to take notes like I have been. But what else might you like to know from the folks, from our speakers?
Well, if I could just add really quickly,
Sure.
The last question you asked everybody on the panel. One of the things that I think is so valuable in the work is when you receive those emails a year or 2 or 5 years after a class, and that student says, you really changed my life, or I've moved on to a 4-year institution, and they don't really care about my name or who we are, or it's a totally different experience, right? I had a very moving email from a young woman I had 2 years ago who flat out said, Dr. S, you were really helping me through the time when I was trying to take my rapist to court, and I won. Yes. And he's going to jail, and the world is safer. I mean, there's stories like that are super large out there. There's I can remember another set of young men who asked to leave class because they were worried about a friend, and they intercepted a suicide attempt. So the kind of attunement that you have to your student body through doing this work can literally be life-saving. And I think that it's important to remember, for the one email that you get, there's 10 that weren't written of the difference that you are making. And so just to have kind of that scope over the years, almost 10 years doing the work, is that it is transformative and life-changing, not only for the students, but for you as as an educator as well.
Yeah, that is a pretty profound perspective. I definitely appreciate that. And aside from the sort of validation we can get as instructors when we hear that kind of communication, you're absolutely right, and that is the point, right? Every interaction matters. It counts. It makes an impact, or at least has a potential impact. On the plus side, when we are being positive and supporting our students, whether it's as big as being life-saving or just small enough to keep them in school, on the flip side, an unpleasant experience can get them to just say, well, I don't belong here, and walk away and never come back. And, it's too easy for students to slip through the cracks if we're not paying attention to them. To let them know that they're seen, so that they feel comfortable being able to to communicate with us their issues and get through that kind of thing. Let's see. I see a question in the chat. I've been asked to see if Caring Campus can be used at our college. What would you say to try to have Caring Campus considered as a program? Dawn, can you say a little bit more about that? Which college are you at?
Hi. I have no idea where my camera is, so I'm going to turn it off. It's not working. Okay, so I was just randomly assigned. I'm with data and assessment team, and someone was walking by and said, "Hey, can you look into seeing how we could implement this here I'm at Iowa Community College, DMAC, Des Moines Area Community College, and to see how, or if it's worth implementing, how it could be implemented." We're probably a medium-sized community colleges with like multiple campuses and then high school academies, and it's just very spread out throughout the state. So I'm supposed to come up with a one-pager on how it can be implemented here.
Yeah, sure. Actually, what I would ask is if you contact me directly. I'm actually quite familiar with DMAC. I got my bachelor's degree at Iowa State and my master's degree at Northern Iowa. So I've been all around the state, and I used to live not far from DMAC once upon a time. So I would be happy to get you introduced and see where we can go, how far we can go with this at not just throughout the system in Iowa. That would be great. Thank you for asking.
Thank you.
And I'll have my contact information at the end of the presentation. Oh, there's a QR code. Natalie, whose QR code is that?
That is ours that I just wanted to put up in advance so that if you'd like to click on that link or scan that QR code, it will take you to a little feedback survey for today's roundtable.
Ah, excellent. Thank you. Yeah, we are always here at IABC also trying to improve what we're doing. And so we appreciate any feedback that we can get about this session from everyone who's willing to share. Any other questions for our panelists? We're looking for clarifications. I know we're starting to run short on time here, so I'll ask the last question then. What would anybody add? Are there any other ideas to add to our long and growing list of ways to spread the Caring Campus spirit amongst not just faculty, but perhaps employee groups in general?
I think it would be great if we had again, it goes back to sometimes it feels like we are, we brainstorm all the time. Sarah can tell you that we're always brainstorming ideas, but I think since we have a network, right, it would be great if we had things like best tips to do, and then whatever that question is. And having that would be fantastic as a starting plank for us, right? So those kinds of things are very, very useful. And at least we know we're on the right track, or it can springboard to other thoughts. So I just think that would be something I would definitely welcome.
Again, you are right on top of things. Actually, once again, that's what these discussions that we're having online are for one thing. I do know also that as a matter of just communication from IABC, we have a sort of tips for implementation document that is coming out soon. Well, there's a new one I think that's coming out soon. Actually.
Cool.
And I'll make sure that you get to see that.
And it could be also, I thought that question was really great about resistance, because and even though I don't feel we have a lot of resistance, I do find that what I worry, I'll tell you what I'm concerned about. I'm concerned that, like, I always ask the question, well, for example, we ask our faculty to, in a sense, sign a pledge, right? You don't have to. It's like we send it out, and it's like the caring concept amendments, if you will, right? Things that we want all of our faculty to do that first month of class or what have you. But then I wonder, and I say to myself, okay, well, that was great, but how do we know that's actually being carried forward, right? We hope, right? I see Shannon, she's kind of looking like, yeah, that's true. We hope, but things like tips regarding things like that, implementation tips, or ways that we can get our faculty to truly understand. I think what happens is that, you know, they get excited at the beginning and then we go to teaching, right? Which is great, but whether or not they're threading that needle the entire semester is a whole different thing, right? And having, I believe, Shannon, you said you guys were in this for about a decade, right? I mean, valuable resource there that can help those of us who are at the beginnings of this.
Gary, we actually pay our adjuncts. I think it's something small like $50 a class for, you know, a certain amount of head count. So we have a process by which we do and you know, the majority of our people are adjuncts doing the persistence project. So we do throw people a little bone. We wish it was larger, but it helps to say, you know, we at least value what you're doing. And so that's a big component. And you know, it's just by honor system.
That's right. It is.
What we found out is that people will self-identify. Oh, you know what? I didn't get to all the commitments. Take my class, you know, and they do. So, you know, it could be that people are not doing it and also confirming and getting paid for work they're not doing, but we just have to go on the trust and honor system, because our whole slant is that this is a culture.
It's a culture. Yes.
To be a part of and to be proud of. And certainly helps that there's so much movement on relationship rich education.
That's right.
But you know, the truth of it is that we're facing an epidemic now that our Surgeon General Vivek Murthy says is the epidemic of loneliness, of isolation. And I think that you know, sort of at ground zero in these academic spaces is the place where we're seeing this play out the most. So there's not a single professor that hasn't had a student with mental health issues.
That's right. But, you know, it kind of goes back to what we were saying earlier, which is, I know our last meeting, we're really going to begin to really focus on the faculty care piece of this, because if you think about it, if I think Bola mentioned this, that if you're addressing the issues with the faculty and showing them that you care on on even a higher level than what you're doing, then that will then trickle down, right? That will, I think that is an area of huge focus for us. I know for this year particularly. Well, they said they want their own space, their own sort of what was it, Sarah? They want their own area, like a room where they can just decompress.
Yes.
So we're working on that.
That's wonderful. You know, if you do any trauma-informed teaching, you know, professional developments, the first thing they're going to say is trauma-informed care begins with the self.
It does.
And so to remind our people who are doing the work that your health is a priority, and you do have to take breaks when you need them. And
that'll go a long way. Yeah.
As a coach, I'd like to also remind everyone that during the pandemic, IEBC created 3 Caring Campus guides, and they are available on the website. And one of them specifically addressed how leadership can support the folks on their campus during that difficult time. But I think it continues to resonate.
Sure.
And I would encourage you to look at those 3 guides. They're terrific. They're really terrific guides.
Oh, great. Thanks.
Yeah, they are great resources. Thank you for reminding us of that, Jordan. Excuse me.
Yeah, and I guess as I know we're running short on time, as the faculty member and the administrator on the panel today, you know, we throw a lot of stuff at faculty that they're trying to do, right? Outcomes assessment and, you know, teaching their classes and committee work. You know, this is, you know, relationship building. It's tough work. We're working on trying to work it into like a weekly schedule where they get little reminders, like, you know, take care of yourself this week. You know, let's all, you know, care for the students this week, you know, try not to, and I think Brian said it well, try not to do too much, you know, too quickly. You got to know what the right size is for what you're doing too. And for each faculty member, it might be different. Some might be really good at what they're doing and some might need smaller baby steps to get to where they're getting.
But at the same time, it's the consistency and regularity, making sure that we keep going and never let it go by the wayside. That helps to make all of this powerful. That's awesome. Thank you. Okay, so yeah, I do want to be respectful of everybody's time. We're about out of time. So we have been getting our feedback there. So I just want to remind everybody once again that if your college or university has been through Caring Campus, either faculty, staff, administration, or any combination of those, this year, ECMC has paid for your membership in the network. So your school is a member of the network, and we will be getting more information, widespread broadcast about that in the next month or two. And then again, do not forget about the Academy as a way to help with onboarding, because we have heard that. And so we're trying to respond appropriately. We're hoping that it's going to be a really powerful way for us to be able to support the colleges and universities that we've been working with. I will remind everyone that we have a YouTube channel where many of our schools have shared their own videos, whether they're training videos or other informational or information for students, where you can see what's going on at other colleges already. That's sort of the beginning of the network, if you will. It's been around for a while, but please feel free to check it out and subscribe. Whoops. The wrong direction. And last but not least, here is my specific contact information. The QR code goes to my digital business card. But please feel free to reach out to me or to any of us here at IABC, your coach via your liaison, or one of us directly, for any kind of support that you might need. We are here for you, and that's why we're building the network, is because we want to continue to support our schools as strongly as they are trying to support their students. And with that, it is 12:30 Pacific, so I am going to thank everybody, especially our panelists. Thank you so much for all of your shared wisdom and your shared enthusiasm. And thank you to everybody who has stuck with us through this hour and a half. I believe it was a really powerful discussion. Again, we'll be making the PowerPoint and the recordings available to everyone afterward. And please fill out the survey if you get a chance to. And thank you. Thank you so much for your time. Have a wonderful day, wonderful weekend.